Many people are worried about coming to the medical clinic because they're fearing that they may be exposed to infection and viruses. In reality, coming to the clinic is a lot safer than going to the supermarket. When you arrive, first thing that we do is to check whether somebody has any symptoms of a respiratory infection. So the receptionist will be asking that when you arrive, if you have cough or runny nose or sore throat or fever. And we're also doing that even before that when you make and ring for an appointment. So we'll be checking that as well. And that means that we can immediately isolate anybody that may have those symptoms. We do have a separate isolation room. The patient will be given a mask and asked to sit in that room. That means that the waiting room is not being affected by anybody with potential symptoms. When you do arrive at the clinic, you'll also be asked to sanitise your hands, to clean your hands. And we would ask you to sit in the waiting room. We have lots of space so that social distancing is enabled. The other thing to be aware of is that the transmission of the virus is only from close contact with other people. So there isn't a risk of picking up a virus just by being in a clinic. The virus is not transmitted in the air, for instance. So it's quite safe to be sitting down in the waiting room. When you arrive, we advise that you sit down, keep your hands folded or clasped, so that means that you're not touching the seats, not touching any other surfaces, and also it means that you're not touching your face. So it's a very good tip, not only here but in any other place that you may visit. For ourselves, when we arrive, our procedure is to sanitise our hands immediately. We then change into our scrubs so that we're not using any clothing that may be contaminated from outside. We're putting masks on to protect not only ourselves but also protect our patients from any viruses. All surfaces are cleaned with antiviral agents at the start of the day, in the middle of the day, at the end of the day. We have been making efforts to remove any surfaces that may be contaminated. So tables have been removed and reading material has been removed.